So my topic today is off the subject of this conference of Love for Liberty is the quest for medical freedom, and I'll have two sessions. So my first talk will be on the history of modern American medicine in the last 120 years. I think that'll be informative. My second talk is the historic influence of the Christian church in the field of medicine, and then I'll close with alternatives to the medical monopoly. Okay, so first, years ago I took a short course, a tape course on public speaking, and the instructor gave some really good advice in there, and he said, when you start a speech, never give a disclaimer. So I will go against his sound advice because I've got to give you two very important disclaimers. Number one, I'm not a doctor. I've not been to medical school. I don't have any professional training in the medical realm. All right, now I think that's positive because we never hear any commentary from where the average person sits in the pew or in the audience on how they would view modern American medicine. So it's always the experts like the short little Italian guy who disagrees with everything he says from month to month. So my perspective, I think as a consumer, I'm not a man of medicine, but I'm a consumer of medicine like all of you. So I think that perspective is really healthy because I can take a look at modern American medicine objectively. I don't have a vocation. I don't have a practice. I don't have an image to protect. So I think that perspective is good. Disclaimer number two is for the next two sessions, I will be speaking of modern American medicine in a very negative way. However, as Christians, we must be honest in our analysis of everything we do and everything we talk about every institution. And we have to acknowledge when I review American medicine for 120 years of the tremendous advancements that have taken place within the medical community. We all benefited. I mean, we think, I've got friends that's a dermatologist. It's amazing what they're able to do in that field. Orthopedics. I've built homes for orthopedic surgeons, which are really one of my favorite clients because the homes tend to be expensive. And there's just tremendous advantages. I mean, I've even had some retina procedures that probably help save sight in one of my eyes. So we all benefit from it. However, I look at modern American medicine with the 80-20 rule, and that being 80% of what they do is really good. But the 20% of what they do that is bad is so egregious and is so criminal and is so evil, you have to put in doubt almost the whole institution of modern American medicine and critique it. And that's what we're going to do today. All right, no more disclaimers. The first question we have to ask when we talk about modern American medicine is, from a consumer's view of where all you sit, what is your view of American medicine? And it's usually a negative answer. And it's negative because you know something is wrong. People are generally not happy with their medical care, and the word really is disenchanted. So they're disenchanted in the quality of the care, the business of it, and the cost of it. What's interesting, there's always stats that you can pull up on the web on the cost of American medicine from a perspective of a worldwide perspective. So we're number one for cost. We spend on average of 13.8% of our GDP on medical care. Should be around 3%. So it's astronomical costs, but yet there's this difference between cost and quality of care. Forgive me for this next statistic. It comes from the World Health Organization, but once in a while, if it fits into my talk, I'll use it. All right, so in 2020, the World Health Organization did an analysis and ranked the United States as 37th in line for quality health care amongst all the nations. In 2021, the Commonwealth Fund, reviewing 97 category areas of health care of the 11th highest and 11th wealthiest countries in the world, ranked the United States dead last. So the best place, I think, to start with where we are with modern American medicine and where it should be or where it was is in the Hippocratic Oath. Let's see, do I have that here? Dave, am I missing something? Oh, oops. There we go. All right. Now, here's the interesting thing, and we have to think about. The Hippocratic Oath was basically written somewhere around 400 BC, and it comes from the famous Greek physician Hippocrates. It was translated into English in around the 1700s and used in the West for medical students as a code, to swear a code of ethics when they enter the medical practice. The wording changed in 1960, 1964, and they radically changed it because of the COVID-19 so-called vaccine. They changed the oath. So let's look at a few things in here. Let's read it in bold. It starts out with "I swear." So when you put "I swear" in that, you're really making a covenant, right? You're making a covenant between you, your practice, and your patient. Then, when we look at the middle part of this oath, remember, this was the original oath, not the one that was changed. It says and when you think of the middle part, the areas in bold, think of Fauci, think of COVID-19 and what transpired. So we have here, with regard to healing the sick, I will devise and order for them the best diet. Well, that's interesting. Physician interested in diet. They don't ever get any education on that. According to my judgment and means, I will take care that they suffer no hurt or damage. That's the section of "Do thy patient no harm." All right? Again, think of the COVID-19 scam. Nor shall any man's entreaty prevail upon me to administer poison to anyone, neither will I counsel any man to do so. Moreover, I will give no sort of medicine to any pregnant woman with a view to destroy a child. Look at that. And look at where we've come, where we're given this mRNA poisonous drug to children. And further, I will come forth myself and use my knowledge in a godly manner. And let's skip down to the bottom. I will faithfully observe this oath. May I thrive and prosper in my fortune and profession, and live in the estimation of posterity, or on breach thereof, may the reverse be my fate. So as in every covenant that you swear by, you also pronounce the curse if you don't live up to it. So that's really a disastrous place of where we should be in the medical community and where we are today. All right, let's go further on. So let's discuss the history of modern American medicine, and I think we've got to go back about 120 years, really almost the turn of the century in the year 1900. So whenever you discuss an institution, whether it's politically or even in the medical realm, you have to look back at the founders. Okay, who founded the modern system? What was their worldview? What was their purpose? What was their agenda? And you can really, if you understand that, you can understand the condition of where we are in modern American medicine. So, now, I would normally think, oh man, it's not. Oh, there we go. Oops. There we go. Okay, so when you're thinking of the founding of the medical field in a modern way, you're generally going to think of a biochemist, a physician, or somebody in the medical realm that's come up with some great discovery. So the first one there on your left is Robert Koch. Here's what I would think would be the founders of modern American medicine, right? Or Western medicine. You have Robert Koch, the German physician, the microbiologist, and he gave us Koch's postulates, which is the 4 little areas of how to determine a virus that they didn't use when they came up with COVID. And he was mid to late 1800s. Then you have Joseph Lister, the English surgeon, who radically changed the way we do surgeries. That is, his process is still used today. Great man. Then you have Albert Gorky, who was discoverer of vitamin C, first to isolate vitamin C, right? So you would think some of these three men would be the founders of American medicine, but that is not the case. And so these are the 2 founders. So hang on to your seats there. I didn't put their names. You recognize the faces? How about the eyes of Mr. Rockefeller, John D. on the left? You know, you can tell the soul, what's underneath there, when looking at his eyes. The other one is Andrew Carnegie. So you ask the question, what in the world is a oil man and a steel man involved with the creation of modern American medicine? All right, so I'm glad you asked the question, and we are going to discuss it. What happens with these men is both of them ended up with so much wealth, they had more money than they could spend, and they developed foundations, the Rockefeller Foundation, the Carnegie Foundation, and they used their money in benevolence practices, and some of it is very good, but much of it was to use the money to control other institutions, which is primarily what we're talking about today in medicine. Now, the men of great wealth always had to delegate everything they did. Obviously, they didn't have time. So here's four important men involving modern American medicine. You have Frederick Taylor Gates, who, interesting enough, worked for John D. Rockefeller. The Rockefellers hired him. He was a Baptist minister out of Minnesota, and he ended up working for John D. and helping organizing a little bit of his businesses, but Rockefeller put him in charge of all his benevolence work and his foundation. I think he was a better administrator than he was a Baptist preacher. Then you have John D. Jr. on the right. That's his dad. John D. Jr. was somewhat of a timid man. He wasn't near the businessman that his dad was, but he was involved very much so in the work of the foundation, and he worked directly with Gates. So that's the Rockefeller wing. On the Carnegie wing was Henry Pritchard, who was a very able man, and he handled Carnegie's foundation work. The other one that we'll talk about in a minute is Abraham Flexner, probably the most important of all four of them there. All right, so the best way to look at modern American medicine is look at a timeline. So we have on the very top, the creation of the American Medical Association was created by a physician in New York with good intentions, but as you know, as things progress, they get corrupt. Then the AMA was incorporated in 1897. The Carnegie Foundation with Rockefeller bought the AMA for $10,000. A lot of money back then, but really not for these men. So then you have in the 1900s the discovery of petrochemicals, which was combined and used in the pharmaceutical industry. Then in 1901, Rockefeller funded the Rockefeller Institute for Medical Research. So this is around the 1900s, they started cranking up their control of modern American medicine. The AMA created the Council on Medical Education. And let's skip the Flexner report, which is really important, and go to 1913, 2 critical years. John D. Rockefeller, through his foundation, created the General Education Board, which is the nonprofit institution that funded all these medical schools and changed how medicine was taught. We'll get into that in a minute through the Flexner report. Then we have, in 1913, in New York at the Harvard Club, John D. Rockefeller announced he was creating the American Cancer Society. Again, you would think a physician would have created it, but no, an oil man created it. And they've never really been too good for the last 110 years on curing cancer, have they? Cancer first is a business. Cannot forget it. Then at the same time, vitamins were discovered. And then in 1918, Johns Hopkins, which is the key deep state school of medicine in Baltimore, was founded. And then it's interesting, 1918, the Spanish flu was incorrectly named. Through the Rockefellers' involvement with medicine, they had given the soldiers at Fort Riley in Kansas the vaccine that caused the Spanish flu epidemic. So that's interesting. So it really should be named the Rockefeller flu, because these soldiers ended up going to Spain and Europe, and then the whole pandemic spread. So then what's interesting too is the World Health Organization in 1944 was created by David Rockefeller, and it's a Rockefeller institution, which is why we have such a problem with the WHO. Okay, going back to Abraham Flexner. Flexner was was an educator. He was a Jewish family out of Louisville, and he He wrote the book on the American college and about revising the whole educational system and higher education. The Rockefeller people found out about him, and they hired him to go throughout all the medical colleges in the country in the early 1900s and to see, to write a report which became the Flexner Report. So it's one of these reports, they came up with the conclusion before they did the research. So his research, basically, Abraham Flexner's, was that there's too many doctors, too many medical schools, and the need for standardization of medicine. So they worked with the AMA to control licensing in the early 1900s with the doctors and to control the medical schools. All this was put together with the politicians. So here's the breakdown. 1910, there was 166 medical schools. 21 of them at this time, because of Rockefeller's control, closed their doors. 20 merged and 133 survived. By 1915, there were 115 medical schools left. In 1930, there were 76 that existed. So, let me end with this. There's no study on American medicine complete without the mention of the notorious grandson of John D. Rockefeller, which would have been David Rockefeller, who finally passed in 2017 when he was 101. Rockefeller is a prominent U.S. globalist political figure, greatest political figure in the last 70 years. He ran a powerful council on foreign relations in New York, and he was very instrumental, obviously, in starting the World Health Organization and controlling medicine. One thing, too, to remember is David Rockefeller's, the bank was Chase Manhattan Bank. Rockefeller had on every major pharmaceutical company, had a member of his, executive member of his bank or one of his agents sit on the board of all these pharmaceutical companies. American pharmaceutical companies are a Rockefeller operation. So, and I'll just conclude by saying what you're given today on this little brief summary and history of modern American medicine is what none of the doctors get in medical school. I talk to doctors, they have no idea this. So now you can see from that little brief history why you're having difficulties with your health care and what's going on in medicine. And we're going to get into more of that on the second session. Thank you for your time.